So we're looking at the skin from the keloidal reaction on the scalp that I showed the growths and the clinical images from. If you look at the edge here, this would be normal skin here, but there's a lot of pathology here that I want to show real quickly. So it may take a little video time, but I just want to peruse around so I can, and I'll hit on the various pathology. So you can see here, there's a start of a reaction around a pilosebaceous unit or follicular unit. And as we continue to go on, this is a good sample to study skin inflammatory processes. So you see that the epidermis become very reactive. Acanthomatous hyperplasia of the overlying epidermis. There is some parakeratosis and some orthokeratosis, and then you get this inflamed scale crust with abscess material in it, neutrophils that is, within the epithelium as well as in the cornea, the horny layer of the epidermis. And you see this, again, this reactive hypoplastic epidermis overlying this inflamed scar tissue. But we'll talk more about the dermis as we continue to peruse around, as we initially look at the surface epithelium, showing a remarkable reactive hyperplasia here. And in other areas, you're going to start seeing some ulceration. I don't know if it's in this image here, but there was actual frank ulceration of the overlying epidermis, but not actually in this particular section here. And so I'm going to continue to peruse around for you to see the gestalt of this inflammatory process. And it is what we thought, keloidalis or keloidalis reaction. Basically an inflammatory reaction to hair follicle, entrapped hair follicles and hair fibers with an exuberant chronic inflammatory infiltrate. But we're going to go down closer to point out a little more of those features there. In fact, we're going to go down now. But before we go and look at the inflammatory cells, because I know we don't have a lot of time, and a lot of this can be going to be repetition, but there's a little area of ulceration that I was talking about where the epidermis is now have gone away and it's replaced by inflamed abscess material and necrotic debris. So we're going to go down and look at the reaction around the hair follicle. But before I do that, I just want to show you, you see if I can go, I may need to go down so I can show you or convince to you that scar tissue, those little bundles of scar tissue, pink fibers, that's keloidal fibrotic scar tissue. And then we're going to go down and show you now the inflammatory cells that are surrounded. And in this particular case, most of the inflammatory cells, there's a mixed inflammatory cells, in fact, of acute and chronic inflammatory cells, neutrophils, there are lymphocytes, histiocytes. And in this particular section, there was quite a bit of plasma cells in this particular reaction, skin reaction. And while they are in clusters and in groups, those are reactive plasma cells. They don't look atypical. They look like your typical normal reactive plasma cells. Some are bilo, but two nuclei within some of these plasma cells. But when you see plasma cells mixed with acute inflammatory cells, more than likely they're reactive plasma cells. These are not neoplastic plasma cells. So it's just an exuberant, acute and chronic inflammatory reaction to, if I can peruse over real quickly, to inflamed and entrapped hair follicles and hair fibers. So I may need to go back to a low power so I can show you the actual hair fibers that are entrapped and inflamed. So we got, let me just go over a little bit. Well, I thought this was a better section to show you, but I'm not even seeing. Okay, here's a follicular unit there that's coming up to the surface there. And then you can see some granulation tissue here. But I thought I had a better section here. It's more granulation tissue around and that's a ruptured follicle there. But I don't see and you can see the epithelium, the polys in the neutrophils within the epithelium. Now there we go. There's a hair fiber there that's trying to come up through that inflamed follicle. So all in all, this is so the sample has been removed, and as you can see, it measures. You're looking at the tumor here, which is a surface skin tumor, probably a keloidal sort of a reaction there. But anyway, it measures right at 2 by right about 2, so 2 by 2 centimeter in maximum diameter. And so we'll send this to pathology. You can see that it was a nice excision with a fairly clear margin, but I don't think it's going to be a tumor per se, but rather a keloidal reaction with scar. But we'll see, make sure it's not a tumor of any kind.